Family Violence Policy and Practice Assessment 2 Oral Presentation by Lina Sultani. Topic is Perpetrator. Good morning, ladies and gentlemen. Welcome to the Commission of Inquiry about Family Violence. We are gathered here to share our experiences and feedback on the effectiveness of current policies and procedures on the topic of domestic or family violence. I would like to draw your attention into the subject of perpetrator in the family violence dynamics and have a critical analysis of current programs working towards the issue of family violence, focusing on holding the perpetrators accountable. Before we start with the presentation, I would like to provide you with a brief description of who is a perpetrator. Perpetrators of family and domestic violence can vary in age and be from any socio-economic demographics, cultural backgrounds, ethnicity, or religion. They can occupy any profession or live in any geographic region. Perpetrators can be of any gender, however, the vast majority are male. So, in relation to the perpetrator and family violence programs, let's have a look of some government initiatives that is already existing. So, in the recent years, prevention has become a major focus of domestic violence projects as it is an important factor not only reach out and assist the victim of violence, but to ensure prevention strategies are put in place to reduce the risk of violence against the victims. One of the steps taken by the government is the introduction of perpetrator programs to educate and rehabilitate the abusers. As we all know and we have seen it throughout our work experiences, that providing that immediate response to the victims of family violence is an approach that has been worked on for so long, but unfortunately the violence against women is still on a higher rate, and therefore having programs that focuses on changing of behavior with not just the victims, obviously, for them as well to be able to defend themselves and know how to seek help, but also to work on the perpetrators and try and rehabilitate them, and if not rehabilitation, at least hold them accountable and responsible for their behaviors. Now, to design any kind of a program or a framework, we need to have methods. At this stage of the presentation, I would like to draw your attention to the prevention methods that is traditionally getting used in developing any framework on any program. I think it's vital for us to see what those methods are, and where down the track during the presentation we'll see which programs or frameworks fall under which prevention method. So we have three types of prevention methods. I'll start with the first one, which is a primary prevention. And primary prevention is before the violence starts, activities or program to prevent before a perpetuation or victimization starts. So they are the very early stages, and with all honesty, this is probably one of the toughest and hardest stages to detect if a perpetration or abuse or violence is going to take place, because we don't have a lot of information at this stage in front of us, and therefore this stage is probably the one that we need to do more research and gather more data to be able to design frameworks and programs that are effective in detecting that kind of behaviors. Secondary prevention is when the problem has occurred. This is the stage for immediate response to victim and primary consequences for the offender or for the offense that has been taken place. Secondary prevention is obviously the stage that if the police is called, obviously police presents statements and victims statement, and they are the stages that we follow, and this is where at least the organization or the service provider is in a position to determine what program is suitable for the victim and what sort of assistance or accountability or a rehabilitation program, for example, is required for the perpetrator. And then we have tertiary prevention, which is the stage where long-term plan and response is required to prevent the problem from happening again and minimize the impact of it on the victim and anyone else involved. So at this stage, we need rapid and coordinated responses to the perpetrator, minimizing the likelihood of them reoffending. Now, these programs can range from crisis care for the victim to counseling, anger management courses, and other forms of therapy for the perpetrators. I would like to actually add in that it hasn't been mentioned here, but also consequences for the perpetrator. We need to hold them accountable. We need to make them realize that they are not the victim. They are the perpetrator. They have committed an offense, and they need to be tougher consequences. But that's just my personal view on it. We'll go to the next slide now. So using those methods of prevention that I just discussed in previous slide, government and other agencies develop or create approaches of how they're going to target family violence, how they're going to hold the perpetrator accountable. So just as an example, let's have a look of public health approach. So the public health approaches have been applied into dealing and responding to domestic violence in recent years. So this is not a very old approach. It's quite recent, and the research done by the Victorian Health Promotion Foundation discovered that women aged 14 to 44 who suffered or suffering domestic violence usually develop severe health issues. And this is, I think, something that we all understand, that domestic violence obviously has so many forms and so many shapes and so many faces, and these record or this statement here obviously tells us that women as young as 14 can be victims of domestic violence, which is very sad and horrific. And obviously the involvement of health sector was based on the research they did on the health and well-being of these group of women. And down the track, when they interviewed and spoke to this group of women, they obviously came down to a conclusion that their health conditions, whether it's mental health, physical health, or even different kind of diseases, are all linked to how they have been treated in their family. the impact of family violence is huge, and therefore the public health approach was developed to do their part in managing these cases. Also, 1 in 3 Australian women have experienced physical violence since the age of 15, and almost 1 in 5 have experienced sexual violence. According to the Australian Bureau of Statistics, in 2015, over 350,000 women experienced physical violence, and over 125,000 women experienced sexual violence. And this part is taken from the National Plan to Reduce Violence. If you guys would like to refer to it for more details of these statistics. So public health system, on the other hand, is not sufficient in addressing the inequality in genders that are causing violence against women. The public health system is based on the ecological framework, which operates from a different angle to the social framework. So in saying that, as much as individuals or social workers, we all appreciate the involvement of all government agencies and organizations to take part in reducing violence against women. It is evident that the public health approach cannot only deal with the raising numbers of violence occurring towards women. So we need more help, we need more funding and more assistance and more comprehensive programs that look at the issue from a different perspective than ecological framework. Because under the social framework, there is a lot of other aspects that will be taken into account, like education, family background, individual characteristics, drug and alcohol, mental health, poverty, and in many other social aspects of why violence against women is in rise, and why in what we need to do to, if we can't minimize it, at least manage it. We'll go to the next slide now. Let's have a look of the current programs that we have in place. And I'm sure we all know that there is a lot of programs currently available or currently working towards preventing violence, and due to the time limit, I am only going to name a few and only going to talk about a few of them. Some of them are about other states like Perth and Melbourne, and majority of them will be about New South Wales. So policies such as preventing violence before it occurs is one of the widespread programs that gained large popularity across Australia. This framework was developed by Victorian Health Organisation. We have another program that's called Change the Story, which is work of Kim Webster, who speaks about the correlates or underlying factors that causes men to use violence against women. And this is connected to the point that I previously mentioned about those social factors, about the underlying causes of men becoming so violent towards women. So the work of Kim Webster is a thorough, comprehensive framework that discusses all these factors. And this framework, which was developed obviously by Kim Webster, provided the government with a blueprint, with a vision to base the future policies. Uh, and in saying that, if we have a look of the most recent national plan to reduce violence against women, released by the Council of Australian Government in 2016, recommended that all jurisdictions commit to implementing the Change the Story framework. So therefore, we can see that the work of Kim Webster and the Change the Story framework was obviously comprehensive. It has taken all aspects of the issue into account, and it is strongly recommended for all states in Australia for this program to be used in their policies and procedures when developing programs for managing domestic violence. We'll continue with our slide. Continue with change of the story. So let's have a look of the key contributing factors of this framework. So individual, so the individual part of this framework is focusing on belief in rigid gender roles. So whether we, to say it in quite normal words, whether we want to admit it or not, we have a certain part of our society, some individuals do have those rigid beliefs and ideas about gender roles, which automatically, apologies for my pronunciation, puts women as a second-class citizen, puts women not in a position of power, based on those beliefs, based on those individuals' understandings of whether it comes from their culture, whether it comes from a religion, or whether it's their individual point of view. It just puts the women underneath men. Community and organizational, that's another thing that has taken into consideration, which is acceptance of traditional gender roles. And that is from the World Health Organization 2010, European Commission 2010. Acceptance of traditional gender roles. Now, in saying that, we need to, under that framework, that there's specifics of what those gender roles are and how that can be implemented in a healthy way where women is not getting used and abused by men, because traditionally that is the gender role for them. The next area that has been focused on is the societal or society. So traditional gender norms. That's again from the World Health Organization and European Commission. Now, in our society, maybe we individually even witness it. There are certain things that are quite normal and accepted by some society, and that's considered to be the norms. So in developing that framework, that also has been taken into place to ensure changes need to be introduced to the society to alter or change the norms of society if that is against women, if that is making women as a second-class citizen and takes the power off them, which in my personal point of view is work of Kim Webster is a very comprehensive framework and has taken most important aspects into consideration. Now, according to a survey conducted in 2017 with 425 practitioners and service providers, change the story framework had positively influenced their understanding of prevention, as it clearly outlines gender-based violence and the underlying drivers behind the violence against women. So here we go, once again, we can see that once all aspects of a society is taken into account to develop a framework, we see the outcome of that to be something strong and positive, as we can see that in the survey. It was quite useful to many service providers in understanding what the concept of violence was and why, what are the factors that is adding into violence against women. And I would like to just put one personal view there as well, which in my opinion, the consequences for the perpetrators are not always suitable in my eyes. They get a slap at the back of their wrist and they let go, and they go back to the community and they do what they did again and again. I would like the responsible bodies to take this into account and make those punishments and consequences of perpetrators' action as tough as their action is on women. So then they will be, I think, changes in their behaviors. But that's just my view. We'll go to the next slide. Okay, that is still we're continuing with the current programs. Now, these programs are more focused on the perpetrators. I mentioned the one or two programs that were more general in terms of managing domestic violence, but these ones that I'm going to talk about now is focused on men's behavior, on the perpetrator. So, Men's Behaviour Change Program is one of the largest initiatives by Australian government nationwide that works side by side with Victorian Royal Commission into Family Violence. Queensland also has a program that's called Not Now, Not Ever Report. It's a program and it's an entire report with all the details of what the program is about. And then also we have Engage to Change, which is just a pilot men's behaviour change project, funded under the New South Wales Office of Women through the New South Wales Department of Health, holding the perpetrators accountable for their actions. So in this program, they offer rehabilitation programs. These programs could be offered through NGOs and other service providers, sometime to intervene and sometime to assist. So intervention is before anything major happens, and assistance is after something has happened and they require that assistance with family violence. For example, so this is just one example that I'm mentioning here, which is the family violence informed case coordination as a tool that focuses on long-term prevention measures. Now, the reason I picked this example is that once we talk about case coordination, it is mostly quite comprehensive. When we do case management, we do take most of the aspects like mental health, drug and alcohol, education, life skills, employment, and many other aspects of that individual or that family into account when we are case coordinating. But the good thing with this program is that focus will be on the perpetrator, which is 85%, I mean, that's a last big figure, is men. So men is the perpetrator, men needs to change, and they need to be the one that are engaging in these programs, taking part in these programs to change their behavior towards women. And I am a strong supporter of, in personal terms, of programs that are focused on men. Um, we have programs around, keeping the victims safe and removing the women from their house, their children, putting them in shelters to keep them safe, and that is fine. That is an area that we do need funding, obviously, to make those places a little bit more livable and comfortable for them. And I'm sure people that work in these industries know what I am referring to. There is lack of resources. Staff are overwhelmed with their caseload and all that. But I think, based on what we see, the figures of domestic violence going really, really high, we need to work on the perpetrators. We need to work on men because they cause violence, not women. Okay, and the other one is so the case coordination was one of their tools that they use, and the other one is they offer 4 individual counseling appointments to assess these perpetrators' hopes and goals for participating. So we all know that if we have counseling offered to perpetrators as a mandatory rehabilitation, usually they just attend it because they have to. But with Engage to Change, it's just 4 individual counseling appointments. In these appointments, they are counseling, but it's more like they want to talk to these perpetrators, what they want to do, what is their goal, and then from there, they will be referred to counseling sessions that are more appropriate to their need, which I think is a very good starting point to see where these perpetrators are. Do they want to go back to their families or not? Are they even able to go back or not? Because some of them could be very dangerous, and this is when the law should take action and do something about them. But yeah, so so these meetings are designed to work with men to self-assess. Yes, I like this bit of it because I want them to reflect on their bad behaviors themselves. And they are committed and ready towards non-violence and self-responsibility. Self-responsibility is another thing that men or the perpetrators need to know. They never take responsibility for what they do. And these programs, Engage to Change, is a very good platform to let the perpetrators or the men know that what they have done is their responsibility. They have done it and they need to change. We'll continue with the slides now. And at this stage, there is a very interesting video by Jackson Katz. It's a TED Talk. I have put the link there, and the title of the video, as you can see, that's the reason I picked this. It's such a good video, and it says it's a man's issue. Yes, correct. It is a man's issue. Family violence, domestic violence, abuse that is happening to women is men's issue. And we need to have programs to help them, also to hold men and perpetrators accountable. So we'll go to the next slide now. Removing the perpetrator from home, not the victim. This is one of the most effective programs that is an initiative from the Western Australian government. It's currently getting practiced in Perth, and this is one of the programs that is directly targeting the perpetrators, removing them from home instead of removing the women and the children from home. which will have a lot of changes entailed with it, change of school, change of work, new residents, things like that for the women with a lot more responsibility. Their focus is to remove the perpetrator because they want to hold the perpetrator accountable, making them uncomfortable, making them understand that they've done the wrong thing. And that is one of the programs that I highly, and in my view, I think we should have more programs like that in New South Wales as well. I am not aware of any similar programs at the moment in New South Wales, but I think that will be an area that we need more focus on to um, make the perpetrators accountable and remove them from homes instead of shelters for women and all that. That helps with reducing violence. But despite all these programs, in 2014, Australian Bureau of Statistics recorded 95 victims of family and domestic violence related homicides, with the largest number of victims in Victoria, which was 32, followed by New South Wales, which is a shocking statistics, and which tells us as service providers and policymakers and developing frameworks that we need to shift our focus to perpetrators changing their behavior, consequences that is as harsh as their crime, and if they are able to rehabilitate them. According to Australian Bureau of Statistics for the state of New South Wales, 79% of serious violence against women are perpetrated by male family member or intimate partner. These figures were collected in 2019, so they're not old. They're 2019 figures. 79% is a huge figure, and it shows us that the gap in the system is we need to pay additional focus into programs that that is dealing with perpetrators. So this is the end of my presentation, and I hope it communicated the areas where we need more support. And if anyone has any questions, I am happy to answer them now.